So I focus on childhood obesity. Particularly, I'm medical director for the Comprehensive Adolescent Bariatric Program, as well as medical director for our obesity clinic. And so today we discussed issues about sleep, mood, and ethnic disparities, and generally began to describe the range of data available on whether sleep is related to childhood obesity and how that is impacted by ethnicity. Clearly, there remains a lot to be done because we have multiple associations of sleep and obesity, but no demonstrations that really intervention on the sleep domain would actually change the weight status. So it's inferential. It's strongly inferential that sleep affects obesity, but not very definitively proven. There's fairly good consensus that sleep and obesity are associated. However, it's not clear which one is the chicken and which one's the egg. Does obesity cause the sleep disturbance, or does the sleep disturbance cause the obesity? We have very little data on that. There is certainly some research data beginning to emerge that sleep disturbance alters the hormonal milieu with a decrease in leptin production, an increase in ghrelin production, and an associated change in appetite, so that there is reason to believe that sleep has an impact on inducing obesity, or at least more obesity. In addition, there's information on how sleep disturbance affects mood in children, causing attention problems, hyperactivity issues. So there are reasons to believe that this also creates problems for children functioning in school, which may have an impact on how they approach food and other interactions. So we reviewed the United States longitudinal study of adolescent health, which was able to demonstrate, when looking at 4,486 adolescents, that there was a linear relationship in males with sleep deprivation and obesity, but not in females, and that increasing sleep by 1 hour could potentially reduce obesity in terms of BMI Z-score by 0.08, a small reduction, but a suggestion that sleep may be important in controlling weight. When you're not clear on what's the chicken or egg, you're not always sure that you need to intervene unless something is very severe. Our studies clearly show that children sleep less currently than they did 20, 30, 50 years ago. So short sleep seems to be characteristic of our current society for both children and adults. And the other thing that was quite obvious from the studies is ethnic minorities, both Hispanic and African American, have much shorter sleep than Caucasians. And so to the extent that short sleep is contributing to obesity, this is of particular concern. I think the most significant thing was the extent to which all of the literature is consistent on that there is an association between sleep and obesity, despite the fact that the studies are not ideal. Also the fact that in the few longitudinal studies that have been done, ethnic minorities had more sleep, more short sleep than Caucasians, and that was sort of a pretty general finding across, and it was not, that was sort of a surprise to me that it was so uniform across this data. The major reason is they're cross-sectional studies, so they really just show associations. They don't tell you what is responsible for what. So it's not that they're bad studies, they're just not able to tell you which direction you're going in. They're just telling you they're all in the same pot together.